Welcome to Beyond Breathing, the podcast for everyone who breathes and sleeps. I'm your host, Lancette, and I'm excited to help you navigate wellness through breathing, airway, and sleep. In each episode, we'll be joined by expert medical professionals, sleep specialists, wellness coaches, and individuals who have conquered their own sleep struggles, adults and kiddos too. We'll dive into the science of sleep and breathing and its impact on our health. We will explore sleep technology and uncover practical tips and techniques to enhance your sleep quality, your mood, and overall health and wellness. So get ready to breathe well, sleep well, and live well. And thank you to CR Sleep, Airway, and Wellness Center in Reno, Nevada for sponsoring this wellness journey. I am so excited to introduce our guest today. Barbara Tritz is a biological dental hygienist in Washington State. She has been recognized as a top dental blogger and is on an amazing mission. I'm really excited to share this with you guys today. She's on a mission to really encourage the public, medical providers, and dental professionals to join in on a very new movement that's happening really across the globe about looking at how we treat health and disease differently. And instead of putting Band-Aids on, she is on a mission to change the system where we are all addressing the root causes of chronic diseases instead of just treating the symptoms. So before we really dive into her story, let me just tell you a little bit more about how amazing that she is. She's an international guest speaker, writer, practicing biological dental hygienist in the office of Green City Dental in Edmonds, Washington. She's also the owner of Washington Oral Wellness in Kirkland, Washington, where she practices orofacial myofunctional therapy. She completed her accreditation in biological dental hygiene through the International Academy of Oral Medicine and Toxicology, where she is now the chair of the Biological Dental Hygiene Committee. Congratulations. Biological dental hygiene and finding the root causes of dental diseases has been her driving passion. Her interest in all things health related spilled over to creating a blog and website, Queen of Dental Hygiene. She loves to share her knowledge and help others find their total body health. She lectures everywhere from local classrooms to professional continuing education courses across the globe. She has received numerous awards, and we are just really so incredibly lucky to have her here today with us. So, welcome, Barbara.
Well, thank you, Lancette. It is an honor to be with you today. Thank you.
So for today's podcast, I thought we could just start off with the topic, today's topic. Why would a dental hygienist care about mouth breathing or sleep apnea? Where does, dental health and overall health and mouth breathing and sleep apnea, how does it all kind of play together? And, just kind of give us 2 or 3 reasons why every single dental hygienist should care about these issues.
Well, that's a mouthful. Yes.
I know.
So mouth breathing is the root cause of many of our dental problems, from crooked teeth to tooth decay and gum disease and bad breath. And then it spills over into chronic systemic diseases. So in order for our patients, number one, to have a healthy mouth, they've got to breathe through their nose. And, we fight tooth decay with Band-Aids like fluoride, and then gum disease, we scrape the heck out of teeth and polish, and then we yell at our patients for not doing enough oral hygiene. And we need more fluoride, and we need more toothbrushes, and we need better toothpaste. When really the root cause starts here. With our nose. We need to breathe through our nose. When you nasal breathe, you have a healthier oral environment. And so, in order to fight our dental diseases, we've got to start talking about nasal breathing and recognize the signs of mouth breathing and really help our patients learn how to use their nose. Nasal hygiene is as important or more important than oral hygiene.
So before we move on, that's a really good point. Yeah. So then are you recommending that dental professionals now start educating their patients about not only cleaning their mouth, but also cleaning their nose.
Hmm.
That is
Yes, yes,
fantastic.
and how to do it properly, and why, and how to recognize the signs of mouth breathing. When we see acid wear facets, when we see erosion, when we see a uvula that dangles halfway down to their tonsils, or tonsils that look like golf balls. All the signs are there. And dental hygiene is, we are so much more than tooth scrapers and pumice pushers. We have to up our game so that our patients are healthier. And recognizing the signs of mouth breathing is so critical, so critical. Because with mouth breathing, we have sleep apnea, we have cancer, we have AFib, we have sleep disordered breathing, we have dementia. It all comes back to mouth breathing. So, if as a healthcare provider, we need to be aware of those signs.
What would be the best way that you think that the dental professionals could actually find out if their patients are mouth breathing?
Well, when you go get them in the reception room, are they sitting there with their mouth open? Are they looking at their computer on their phone and has their mouth open? Have them download a sleep app and test themselves how deeply they're sleeping. Have a sleep study. Do they have dry mouth? Do they have caries? Every patient that I have that has tooth decay, every patient that I have that has gum disease is a mouth breather. Period.
I have also found it
So,
really helpful in my own practice as a dental hygienist by asking patients, right? Do you typically breathe through your nose or breathe through your mouth? And I'm shocked by how many
mm,
people are very well aware that they mouth breathe. And I find it interesting that that's never on a health history question. When you go to the medical doctor
mm,
or you go to the dental
correct.
practice, to me, that should be one of the number one questions that we are asking people is, do you breathe through your mouth or your nose? And then people will go on to elaborate, well, when I exercise or when I sleep. I also have
Hmm.
found it interesting that most
Yes.
people don't realize the correlation between snoring and having your mouth open. It's actually almost impossible to snore when your mouth is closed. So if you're snoring, that's a pretty good sign too. Are there any other
That is correct.
suggestions or comments that you have about what dental professionals can do to help really bridge this gap and raise awareness about mouth breathing and dental diseases?
I would love for every hygienist to also be an orofacial myofunctional therapist. That should be part of our education, our degree completion, or just part of our dental hygiene, bachelor program. Um, because we really don't know. I mean, until less than 10 years ago, I had no idea there was such a thing as myofunctional disorders. And I didn't connect sleep apnea, and because I had sleep apnea, and I didn't connect that to oral diseases and to malocclusion, to crowded teeth, to jaw dysfunction, and the way people's faces grew. I just thought some people were lucky, some people weren't. And, that's like, no, no, it was all tongue rest posture and mouth breathing, nasal breathing. So it was a lack of in my education, that I went down this path. My daughter started belching, and I was like, how do I fix this? And
Interesting.
it was because she wasn't swallowing properly, because I gave her a pacifier, because I didn't want her to suck her thumb. And so I created this monster. And now when she was a high school senior, she was belching when she got her braces off because now she had no place to put her tongue. And so that started me on this path. It's like, oh my gosh, this is the other half of dentistry and dental hygiene. And I was clueless for over 35 years. And so, and it wasn't in my dental hygiene journals. And I mean, I'm a voracious reader, and I didn't see it anywhere. I had never even heard of it. And so once I did, it was like, oh my gosh, I have missed the boat here. So
So you seem
it's
so
a game
passionate
changer.
about this topic, and you obviously have personal stories with your daughter. How about patient stories? Can you, off the top of your head, can you think of a patient story that has really impacted or changed how you as a dental professional has practiced?
So, yes, I have one patient in particular, Anne, who she had impeccable oral hygiene. And as a biological hygienist, I use a phase contrast microscope with every patient. I take plaque samples, I look at it with the patient, we're looking at the bugs, what's living in their mouth. Is there yeast? Is there parasites? Is there pathogens? And Anne just did a great job with her oral hygiene, but her bones were melting literally between appointments. Like, wow, how do we go from a 3 millimeter to a 5 millimeter pocket in 3 months? And we had to use some creative dentistry to anchor her teeth back in her mouth. And she lost teeth and she had caries. And lo and behold, once I realized what the problem was, she's mouth breathing and it's nutrition. And I was missing my education. I knew something was wrong, but until I learned more about it, it was like, oh, now I know what I would do differently. And it just breaks my heart. So it's put me on a mission because this beautiful woman who did everything I recommended, I couldn't stop her disease.
Yeah, Barbara, can you tell me a little bit more about the use of your microscope and assessing what actually is going on
Hmm.
in people's mouth? Because the vast majority of dental professionals are not using a microscope, so we're kind
Yeah.
of guessing. So, can you just tell me a little bit more about
Yeah.
what you look for and how it helps you treat your patients?
Okay. I have used a microscope from the beginning of my career. As you say, we're guessing. So, I test, I don't guess. And so I take a plaque sample from 4 different areas of the mouth. I go into the deeper pockets and I take that plaque, put it on a slide, seal it up, and look at it on a phase contrast microscope. And so I know pretty well what's going on below the gum line before symptoms occur, before damage occurs, before bone loss, before bleeding. I am seeing the biofilm. And with that biofilm, then I can motivate the patient and I can assess the patient so that I know what is happening, and then how do we fix that before damage occurs? A healthy mouth doesn't have spirochetes. A healthy mouth does not have amoebas. A healthy mouth does not have trichomonads. All of the things that are present on a phase contrast microscope are right there for both the patient and I to see. And I take a plaque sample on every patient every time I see them. And it motivates the patient beyond me just saying, here's your toothbrush. And the patients always ask me, are we going to do a slide today? And it's like, yeah, it's on your tray. I've already taken the plaque sample. We will look at it shortly. But they always ask me that because they want those rewards too. And so
Knowledge is power,
it's a
right?
game changer. It
Mm-hmm.
is. It is. It just and it empowers the patient to want to be healthy. So
So here's
it's
a
a game
trick question
changer.
for you. I don't know what the
Okay.
answer is, but if you were to just look at a slide of
Hmm.
somebody's plaque biofilm
Hmm.
without knowing the patient or their story or their history, would you be able to tell if somebody is a mouth breather just by looking at their slide?
Yeah, I could because the more, you know, the biofilm changes, the pH drops with mouth breathing and it becomes acidic. And so these pathogens love an acidic environment. So just by looking at my slide or doing a salivary diagnostics, the biofilm changes with periodontal disease, with caries. And so just seeing that microscope slide just cements it.
Hmm. Yeah.
It does.
So, is there anything else that you could, impart your wisdom on the medical or dental community about how we're looking at sleep, breathing, um, oral health and oral disease, any last kind of talking points, that you have to encourage us to learn more about how to help everyone be healthier.
You know, I mean, dental hygienists have so much information, and we are just an awesome healthcare profession. And we have boxed ourselves into being the cleaning lady and the oral janitor. And by just upping our game and changing our outlook from that pinpoint to looking at the whole mouth and the whole body and addressing, the breathing issue, the throat development, airway development. Do we have malocclusion? How do we prevent chronic disease? And we should be, expanding our field by knowing sleep and airway and working in an ENT's office, an orthodontist's office, a medical provider, a cardiologist's office. We should be in all of these places as a profession and really being the all-encompassing healthcare provider that we are, instead of just staying in our little operatory cleaning teeth. So it's a vision of mine to, how do we improve the health of this country? We have it. We have the key, and it's all airway development. It's all proper breathing, and so learning about myofunctional disorders should be our baseline. So that's
I
that's
love
my
that. I
my
am on the
mission.
same page with you, 100%.
You are.
We have the ability to heal ourselves. We just don't know how to do it or haven't
Hmm.
been taught to do it. We have people like dental hygienists who are armed with information and want to help educate and assess and treat. So, thank you for being the queen of dental hygiene. The dental hygiene profession is so lucky to have you. I hope to have you again coming back on one of our podcasts talking about
I
maybe
would love that.
something like ozone therapy or something like that. So thank you.
Mm,
Lastly,
yeah.
for our audience who are going to be leaving this podcast with new knowledge, hopefully some new inspiration and a call to action, like what are one or two things that listeners can do to like immediately to help improve their oral health, their breathing, and their sleep?
There are lots of good books out there. James Nestor just wrote a bestseller called Breath, and read that. Learn about airway development and how critical it is to systemic health. And then for hygienists, take a training in myofunctional therapy. And for the public, find a myofunctional therapist so that you can learn how to use your nose properly, how to breathe properly, and then consider, working with them and learning about mouth taping. Mouth taping is so incredible.
I
It's a
know,
game
it
changer for
really
me.
is.
So,
Yeah, me
so
too. Me too. All right. Well, thank you so much, Barbara. Every time we talk, I'm so inspired by you. Thank you for sharing your knowledge and your passion, your expertise. I hope that you all check out her blog, queenofdentalhygiene.net. You can reach her by email
mhm.
at contactqueenofdentalhygiene.net. And I can't wait to see you all on our next podcast. Thank you, Barbara. In the meantime, I hope that we can start mouth taping, start doing some reading, and talking to your dental hygienist about your oral health and that, how your breathing might be contributing to some of your issues or promoting health. Thank you so much. Bye bye.